So this is the care pathway to epilepsy surgery. So once two drugs have been tried, we recommend moving on to what is called the phase one diagnostic evaluation. And this involves non-invasive diagnostic tests. From there, some patients are able to go directly to a surgical treatment, which we call phase three. But for other patients, there's an in-between step, which is why there's 1, 2, and 3 steps. And that's where we need to do direct brain recordings. And we'll talk a little bit more about that later. This can be a long, complicated process that takes several weeks or even months to complete this evaluation. And so we do have a dedicated epilepsy surgery coordinator, Stephanie Riano, who once you're plugged in with this process can help you to navigate it. So don't be overwhelmed by all the different tests and steps that we're going to talk about today. So first, the phase one, the diagnostic tests. The goal here is really to figure out what type of epilepsy you have and where in the brain the seizures are coming from. We broadly put epilepsy into two categories. There are focal seizures, where there's one spot in the brain that the seizures are coming from. And traditionally, these have been the easier types of epilepsies to treat with surgery because we can focus in with a surgery on that one spot. There's more generalized seizures or multifocal seizures, where the seizures seem to be coming from a network of different areas of the brain. And this has traditionally been much harder to treat, but there are emerging therapies with neuromodulation, even for generalized seizures as well. So the phase one is really focused on trying to locate where in the brain the seizures are coming from. So what your seizures look like and what you experience when you have your seizures can help us be the first hint as to where in the brain the seizures are coming from. But we also use a whole host of different advanced tests. So we take a thorough history and we try to learn from what you describe and what your family members describe, where in the brain the seizures are coming from. We also have access to advanced MRI imaging, that's particularly high resolution MRI. We can do video EEG, and you may have already had a short video EEG where you come into the office and get it for a half hour or an hour. This is video EEG where you come into the hospital for at least 24 hours and you're on video the entire time. So we can try and see what those seizures look like and compare that to what we're recording from the wires on the scalp. Neuropsychological testing. This is focused on what type of memory or thinking problems you might have, because that can tell us what part of the brain the seizures are affecting. And then there's a whole host of advanced studies. We don't need to get into each one of them right now. We use them selectively depending on what additional information we need. Special types of MRIs, a whole list of acronyms, PET, SPECT, MEG, WADA. So those are all things that may or may not be important for you, but that are important reasons to get evaluated at a comprehensive center if you are drug resistant. We then take all this data and we discuss it at our epilepsy conference with that full interdisciplinary team that I mentioned before. So when you get an opinion from us about what the next step is, you're not just getting that from the one doctor who's giving you that opinion, but you're actually getting the consensus recommendation from a team of 20 neurologists, 3 neurosurgeons, the neuropsychologists, and everyone else involved in the care team.